Never had you this quiet, Ems. It's quite nice.
On this episode of Bondi Vet,
Something concerning?
I started to feel like a little crunchy feeling in the bladder.
Arvid operates on a rescue dog with potentially fatal plumbing issues.
She can get blocked up and not be able to urinate. That can be a very life-threatening situation.
Death adders are very capable of killing a person.
Tim hunts one of the world's deadliest snakes.
Please be careful.
Okay, I've spotted him. Just stay there.
I don't like the look of that too much.
A few weeks ago it burst.
And Scott feels the pressure when his patient is very close to home.
It's always a little bit nerve-wracking when any of my team bring their animal in.
Whatever you think is best, I trust you 110%.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
What a good girl. What a good girl.
In Atlanta, Georgia, Linda and her pit bull Beretta have been inseparable since her son brought the rescue dog home 7 years ago.
We don't know how old Beretta is because my son's friends found Beretta and another dog tied to a tree, abandoned. No food, no water. That was in 2014, and she's been with us since. Here you go. I was one of those people that was like, pit bulls, no way, they're dangerous, I never want one. And I would tell you now, I would never have a different kind of dog ever.
But Linda is concerned. Lately, her beloved Beretta has been looking lethargic and is having problems urinating.
Beretta starting to have accidents in the house. You can tell that she is uncomfortable with the fact that she's having accidents. She looks ashamed and she hides on her bed. And then when she's outdoors, attempting to go to the bathroom, she appears somewhat, I'll just call it distressed, because she's trying to go and can't. We want some more. She's our little queen. We want to make sure that she has a happy life, a comfortable life, and she gets to enjoy her retirement the best way possible.
Hello, Miss Todd. How you doing?
I'm doing well.
Good to see you. Good to see you.
too.
This is Beretta.
Yeah.
How you doing?
Linda has brought Beretta to Arvid, hoping he can make the dream of a happy retirement come true.
You don't like being the center of attention? Huh? No. I see it in the eyes. I see it in the eyes. The eyes tell it all. So, tell me what's been going on.
Well, she had a little accident on the floor, which never happens with Beretta. So I thought, oh, that's odd. But then when we took her out to go to the bathroom this morning, she attempted to go, but nothing would come out.
All right. What I'm gonna do is just examine her here,
Okay.
see what we're dealing with. The symptoms that the owner's describing is that she's straining to urinate. It sounds like a possible urinary tract infection. Hopefully it's just a routine UTI. We treat that, she gets better, she goes about her life.
But as Arvid examines Beretta's abdomen, he detects something that could put her life at risk.
There's something concerning?
When I kind of feel her bladder, just kind of feel a little gritty, or a little crunchy, if you will.
What would
No
cause
other
that?
term. Well, what I'm hoping is not the case is some bladder stones. Examining Beretta, nothing really stood out until I got to the abdomen. And I'm suspecting the bladder has some stones in there. She can get blocked up and not be able to urinate. If that happens, that can be a very life-threatening situation because it can cause poisons to build up in her body, okay? Not to mention a potential rupture of the bladder. But I just want to take an x-ray to make sure.
Okay.
We'll be right back.
Okay.
All right. It is what I thought it was going to possibly be. She's got a lot of stones in here. Quite a few. All those little tiny white dots, if you will. And the fact that they're a little on the smaller side makes it a very high risk for them to get sucked down into the urethra, which can cause an obstruction. And if she can't urinate, that can be a very life-threatening situation.
Arvid gives Linda the devastating news.
All right, so
Well, that doesn't look good.
it is what I thought. She's got quite a few bladder stones in there. The best way to eliminate it right now, immediately, is surgery. I wouldn't want to wait on it and give them a chance to cause an obstruction.
Sounds like we don't have an option.
Well, I would say that's the better option.
Okay. All right. Well, thank you, Dr. Edward.
You're very welcome. All right. We'll take care of her. My only concern with these surgeries, though, is that when you make an incision into the bladder, a lot of time that just sucks the stones right into the urethra, making the surgery a little bit more challenging. Time to go night-night. There's the tongue.
That still makes my guts hurt. I get nervous when any kind of surgery for anybody or anything. I really don't want to do this, but I get it. We have to. Again.
So there we go. We got the bladder here. And there's some of the stones coming out now. They're just popping out. This bladder is just really angry, really irritated. Pain and discomfort. This big one just popped out here. If we had one of those stones in us, we'd be crying like a baby. So that's a testament as to the amazing pain tolerance that pets have. So what I'm trying to do is just flush them all out.
After flushing out the bladder, Arvid inserts a tube into Beretta's urethra.
I can feel them rubbing in there.
He must flush out any stones that could block her urinary tract and potentially kill her.
So that's what happens. You make an incision into the bladder and it just sucks the stones back into the urethra here. So here you can see all the stones that's coming out. They're just everywhere, and it's just tough to try to get all of them out. The amount of bladder stones definitely would have caused an obstruction, and her life would have been at risk. We saved Beretta's life here today. Hopefully, she's thankful. All right, we are all done. Another life saved, and another pet that's gonna go home pain-free and live the rest of their life happy.
As Beretta recovers from her life-saving surgery,
It's like, oh, just bring her, please bring her.
Linda is anxious to see the abandoned pit bull she gave a second chance at life.
I'm sitting here waiting for her and I can hear her crying back there and it's breaking my heart. She's so stoic normally, doesn't ever make a sound. You never know when anything's bothering her.
Hello.
Hello.
It's been a day. It's been a day.
I hear her crying back there.
Oh, I know she's ready to go home, and she's definitely ready to see you.
I am ready to see her.
I think she's doing just fine because she's got some good pain meds on board. But I want to show you the stones that are in here.
Do I want
You
to?
ready to?
Oh my lord. It almost looks like calcium deposits. Oh my god, that's a lot.
The bladder is completely clean. The urethra is completely clean. Got all of them.
I just can't believe that was in her. I mean, I've never seen anything like it in my life.
In here, look. Beretta. Here we go. There we go.
Your sweet Retta-Roo.
There we go.
Oh, we got a little wag. Come on, let's go.
This way.
Let's go. Oh yeah, she's drunk.
This way. There we go.
Come on,
All
sweetheart. Thank you, doctor.
You're very welcome. Beretta is off to go home and start her recovery process. Like I said, another life saved, and I'm happy.
Come on. Yes. Tell me some more. Yes. Tell me some more.
I'm Dr. Kate Adams and welcome to Bondi Pet, a new destination for pet health and well-being. Our site is filled with everything to fulfill your pet's needs so that you can make healthy choices for your pets.
Hey, buddy. Are you all right in there? Let's see what Uncle Scott says about your little chin.
At St Margaret's, one of Scott's nurses, Emma, is bringing in a very special patient to see Scott.
Hi, guys.
Hey, hello, Ed.
Hello. Hey. Unfortunately, not a social visit, I'm afraid, as much as I wish that it was.
8-year-old Ed is Emma's much-loved rescue cat. She's worried about a nasty lump on his chin.
It's always a little bit nerve-wracking when any of my team bring their animal in, but also I think it's quite touching because they trust me, they want me to look at their animals and they want me to tell them that everything's going to be okay.
We noticed it a couple of months ago and it seemed to get bigger, and then a few weeks ago it seemed to burst and now it's refilled again. It's obviously just annoying him. Or
Yeah, you're not happy about it either, are you? Yeah, I don't like the look of that too much. Let's bring him into the consult room and we'll have a closer look. Hey,
Come on in, buddy.
come on then, champ. Come on, big guy.
Big man. Where's your mum's boy? Hey? Yes, he is. It's very, very odd being on the other side of the table, actually bringing my animal in for a checkup, not just a social visit. So the nerves are high today, I won't lie.
You know, it looks very cystic, but we also have to think that there is a possibility that it can be one of the more common types of skin tumours that affect people, which is melanoma.
Yeah.
And is he a keen sun worshipper?
Loves to lie in the sun. Loves it.
Clearly that lump is not normal. It looks very angry, it just looks very active. So I do think that we should probably try and get rid of it. Take it out with surgery.
Definitely.
Remove it completely, let mum feel happier about life,
Yeah.
then we just wait and see what the results show.
Yeah. It is super important to us. You know, he's a member of the family. We don't have children of our own, and he is our child. You know, he's there when you wake up in the morning, he's there when you go to bed, he's there when you're sleeping. He's just there all the time. So, yeah, he means everything to us.
Okay, little scratch. Ready?
Good boy.
Good. So, ready for a bit of anaesthetic there, champ?
I don't think I've ever had you this quiet, Ems. It's quite nice. Mummy's nervous, I can tell.
Mummy is nervous. Mummy doesn't do nervous.
All right, baby boy. He's a good boy. He is.
He's a good boy. Mum's here.
Good lad. Yeah, it's okay. Look at Uncle Scotty.
It's definitely feeling a lot more real now that Ed's anaesthetised and on the table, and we're about to take him into theatre. It's actually a big deal now.
Let's have a look at this chin, shall we?
With Emma present for the operation, Scott's feeling even more pressure than usual.
I would say it's quite tricky to have the owner being present and actually helping you with the procedure because normally you act in a certain way with the patient and you need to have that emotional separation.
Wow, actually, this thing goes down quite deep.
Now that Ed's under anaesthetic, I can feel that this lump actually is much bigger than I first thought. It's about twice the size, really. So it's actually like a pea that's under his skin.
You know the rule for trying to remove what is potentially a malignant tumour?
Bigger is better.
And the average margin is about 3 centimetres, which
Yeah.
clearly I'm not going to be able to do. Otherwise, I'd have to take half of his jaw off. So it might mean, worst case scenario, if it does come back as something that we're concerned about, we may have to go back in and do further surgery.
Whatever you think is best. I trust you 110%. So
Okay. All right.
whatever you think is best.
All right.
I think it definitely makes me a bit more concerned knowing that that lump is a lot bigger than what I thought was just a superficial cyst. So yeah, I'm anxious to get it off to the lab and see what they say.
So how's the patient going, Ems?
Patient's good. Patient's keeping mum happy for the time being.
I was actually talking about Mum. You all right?
Yeah.
I know Emma very well, and normally she's very calm and very assured under pressure. definitely more nerves today. You can just see it in her face and her eyes, in the way that she is speaking a little bit less. I can tell that my Em's a little nervous. It breaks down very, very easily. Attach right to his chin as well. Okay, so I think I've got it all out there. Very satisfied that it is now out of your cat. Removing this lump, it really doesn't look very nice at all. It breaks down. It's what we call friable, which is very sort of delicate, and it's very flesh-filled. So I don't know what it is just by looking at it. I don't like the look of it, and I'm really glad that it's out.
It's been a short but tense surgery, and Scott is not the only one who's relieved.
I'm glad we didn't wait any longer to do it. So, yeah, feeling better now it's gone.
So, Ems, this black spot on his chin, how important is it to you and to him?
I mean, it's his little beauty spot, so if we can save it. So Ed has this gorgeous little beauty spot on the base of his chin, which we absolutely adore. And it's part of his personality, I think. So if we can save the spot, that would be great. But if he loses the spot and it means that he's safe and healthy and that we've got rid of something that might be nasty, then that'll be okay.
Only perfection will do is basically what you're saying.
Yes, that's exactly what I'm saying.
It's smaller, but it is still there. And once the sutures come out, it'll look perfect. So,
Thank you very much.
my pleasure.
It's like Cindy Crawford without her spot.
Yeah.
Couldn't happen, you see.
It shouldn't be allowed.
No, this is where I'm very happy that you are a perfectionist.
I don't know if he's as hot as Cindy Crawford. You're nice, but come on, you're not that nice. Emma did a great job today. She really kept a level head, and although she was very worried about Ed and how he was going under anaesthetic, she kept it all inside. She monitored the anaesthetic beautifully and got the result she was looking for, which is her boy woke up perfectly fine.
Come on then, little man. Come on then, little man. Oh, I know.
But Emma won't be able to relax until she gets the results of the tests on the lump.
You rest up again, sweetheart. You rest up, buddy. All right, little man. Back in a sec. Morning, team.
Hey, Ems. Hello, little Ed.
It's been a week since Nurse Emma's cat, Ed, had a nasty tumour removed from his chin. And today, the results are in.
We're back again.
Yeah, he has been a little bit of an headache, hasn't he, of late?
Oh.
He has.
How long did it take you to come up with that one?
Oh, a good couple of years.
I don't quite know how to put into words what I feel about Scott's puns and his bad dad jokes. It's just Scott Miller all over.
Despite her brave front, it's been an anxious time for Emma.
Hate waiting for results. It's literally felt like this has been the longest wait.
All right, then, let's get you into the consult room and we'll tell Mummy some news.
Yes, please.
Emma has been incredibly worried about the result that I'm going to be giving her today regarding Ed's tumour. It was a very angry, very fast-growing tumour, and Emma knows that they are all the indicators of a potentially aggressive tumour, something like cancer. I know how much you've been worrying about this result. Yeah.
Go on.
But the news is good.
Is it?
Yes.
Ah, what is it?
It's an apocrine cystic papillary tumour, which isn't a very common tumour at all. In fact, the pathologist had barely ever seen it. But the good news is that it is benign, and hopefully by removing it, it will never come back.
Fantastic.
Yeah.
Oh, isn't that good news, bud? Hey? I am so over the moon that we have got the results for a benign tumour. That is the best news we could have hoped for. So I'm just enjoying the news that we've got the all clear. Oh, I'm so pleased. Are we pleased?
Hey, you pleased?
Are we pleased?
You happy?
Say thanks, Uncle Scotty.
You don't have to worry. No.
Thanks.
He is such a beautiful cat, and I would say that he's head and shoulders above the rest.
Oh no, it's just getting awkward now, isn't it, mate?
Hey.
Oh, I'm just gonna
Take your cat away.
Take my cat.
Yeah. Save him from the bad jokes.
Bye now.
Bye, Ed. Bye. I think he liked it.
Hello.
Hi, how
You must be Melissa?
Yes.
This is Tyson.
Tyson.
Oh, Tyson. I was warned that he was cute.
He's cute.
Melissa is fostering 3-month-old rescue dog Tyson,
Oh, all right, come on through.
but hasn't decided yet whether she's going to keep him.
Hey, little buddy. He looks reasonably lively, but he just does look a little bit skinny. What's that? Oh, is that the spot, is it? So, Cinezo is obviously just a temporary thing. You two aren't bonding at all?
No, not at all. No, he's beautiful, and the kids love him too. You look a bit worried.
Has anyone mentioned anything to you about his heart?
No.
So his heart isn't doing a normal lup-dup like that. It's whooshing. And if you put your fingers here, you feel that? Like a little vibration?
Yeah.
So my gut feeling going on how Tyson's heart sounds and feels is a patent ductus arteriosus, a PDA. And if this is a PDA and Tyson doesn't have heart surgery, this condition will eventually weaken him and kill him.
Can it be fixed?
I don't know. You're having all this fun with a puppy and then all of a sudden, bang, everything changes.
You're scaring me.
Can I ask you, is this going to affect whether you're going to actually keep him?
I'll keep him now. I can't send him back if there's something wrong.
Yeah?
Yeah.
I'll make a phone call and see if I can get him into our specialist up at Sash.
Okay.
You've got to remember that Melissa hasn't actually formally adopted Tyson yet. So for her to face this crisis and face up to it and go, yep, I'm going to stick with him, that's really something.
Right, Squirt, let's put you up here.
Oh, you're very, very tiny on this big table.
It's very tiny. It's very quiet too.
Oh my goodness.
At Sash, vets Darren Foster and Lisa Chimes are about to give Tyson an ultrasound to find out if Chris's grim diagnosis is correct.
And there it is. Wow, so you can see this dramatic flash of colour going from the left-hand side to the right side. No doubt at all that this is a PDA. I'm afraid for little Tyson, he's going to have some major heart surgery to try and fix him. Poor little kid.
It's basically an abnormal vessel between their aorta and their pulmonary artery, and all humans and animals have that vessel when they're in the womb, but when they're born it's supposed to close off within the first few days of life. And in Tyson's case that vessel hasn't closed off and you've got blood basically shunting backwards in the heart.
PDAs will eventually cause him to go into heart failure if they're not treated.
But he's going to be okay. Can you fix it?
Well, Andrew's here.
Surgeon Andrew Marchewski will be performing the extremely delicate operation.
What do you actually need to do?
Well, we're going to have to go into his chest, so we're going to make a cut in between his ribs and sort of open him right up, so we'll have the heart sitting there pounding away at us. And then you get a pair of forceps and get round behind it and then tie some suture around it. Unfortunately, there's a risk involved with it. The shunt itself, or the abnormal vessel, is quite thin-walled, and there is a risk that we can rupture it.
There's no way I'll give him up now. There's no way. He's here to stay. Getting really nervous now. I know, it's going to be sad. He's going to come out better.
Tyson is returning to Sash for his life-saving heart surgery. This family were only supposed to be looking after him for 1 week.
Hi, Melissa.
How you going?
All right, got everybody here today.
Everybody's here today to say goodbye.
Oh, well, not goodbye.
Not, or just good luck.
See you later.
Yeah, see you later. See you soon.
Has he grown a bit?
Now, despite the operation costing thousands of dollars, they have decided to keep him.
Say bye to Tyson. Say bye. Aww. Beautiful Tyson.
I'm really, really nervous for him, because he's so little.
It's sort of like a bit of a time bomb. He could just suddenly die of heart failure at any moment. They're in the chest. I just have to push some lungs out of the way. If I put my finger on it, I can feel it vibrating. And that's just because the blood's going in the wrong direction. So we've just got to get round this little bugger and get him tied off. I've just dissected down the front and back end of the shunt, and that's easy enough to see. Now I'm going to be going around the back end of it, which I can't see, so I'm going to be doing by feel. And if ever anything's going to go wrong, it's during this bit. So they're not going to talk for a while now. It's always a bit tense. It's you're dissecting blind around the other side, and you're doing it all by feel.
The surgeon must now tie off the abnormal vessel that's causing the rescue puppy's deadly heart murmur. This is where the smallest slip can be fatal.
You've got to be really careful, really patient, really gentle, because if you start pushing it a little bit and you're in the wrong spot, it's a disaster if you push through the blood vessel, and they just die. Whew. There's that sigh of relief. So just tying this off now, you can see his blood pressure changes and that reverberation in his heart's just disappeared. So he's a cure.
Despite the great result, it will still take Tyson several days to recover.
And it's funny, I mean, you look at the published risks of mortality are 2%, but it's just the fact that it's the complication in the surgery's death. It's a big complication.
He's crazy. We want to keep him, but we're so happy to send him home looking so bright and happy.
4 days after his operation, Tyson's heart has the all clear and the popular puppy is heading home.
Come on, Tyson, it's time to go home. Good boy. Come on. Go and walk out. I know. That's it. Oh, so good boy. Come on.
Hello! Hello! There we go. Hello! Hey! It's a puppy.
Thank you so much.
No, that's a pleasure.
Hey, you want to come home? You want to come home?
At the end of the day, we've got a happy dog, happy owner, happy surgeon. It just doesn't get better than that.
We've had a call from a couple from Buckety, and they've got what they've described as a death adder, and it's actually in their front yard, so I'm going to go and grab it. We can use it for the venom program.
Australian Reptile Park Operations Manager Tim Faulkner is responding to an SOS call from the New South Wales Central Coast.
You got yourself a snake?
Yeah. How are you?
Yeah, good, thank you. You think it's a death adder? Death adders responsible for a number of bites each year and very capable of killing a person. They have neurotoxins that effectively put your body into paralysis and you will die. Number 8, most toxic snake in the world.
Yep.
Yeah.
So
You're
we
mad.
won't be picking them up anymore. I hope not. He picks them up, which I don't like, and then drives them away. I don't like it because if he gets bitten, I've got to get him to a hospital and it's an hour's drive.
You've got thongs on, so yes. Please stay there, and you're not allowed to catch it.
That's right.
So
I'm not allowed to catch it.
You've got eyes on him.
Yes.
The easiest thing's just to do this. They're near impossible to spot.
Maybe I need my glasses on.
That's perfect for them. That's what they love, these Banksia leaves. I get nervous looking for adders. The adder's somewhere.
And you can't see it?
No, and you don't know where it is. A death adder doesn't have the ability to take off very quickly like we assume most snakes do. They're short and stocky. They can't just crawl away. He's going to hold his position. He thinks he's camouflaged. If your hand goes too close, you're bitten.
That's it.
No, he's here somewhere. The Death Adder knows we're here. He can sense us. He would have known we're here from the moment we started to walk down this track, but he's going to hold tight.
Please be careful.
Yeah, I will.
It looks like it's gone to me.
No, he'll be there. They're just perfect. They camouflage so well. OK, I've spotted him. Just stay there.
Yep.
You're not going to believe it. There's the head.
Where?
Right underneath my hook. There he is. There's the head. See him?
Yep.
You know, they've got one of the fastest strikes of any snake on Earth. I'll bring him out on the flat there and we can have a look at his tail.
That's amazing.
There we go. I hope that Gav and Des get something out of this too, and not just that the snake's gone, but that Gav stops picking them up, Des keeps an eye on him, and she's careful in the garden because 99 times out of 100 people are bitten by catching the snake, poking the snake, or trying to move it. It's not the person that leaves it alone that gets bitten. Would you like to give him a name?
Oh, just Buckety, I suppose.
Buckety?
Yeah.
Buckety the Death Adder.
Yeah.
Our little Death Adder Buckety is going to come back with me. He'll begin a process there where we milk him fortnightly to extract his venom. We'll send that off to be made into anti-venom and he'll help save a life. This is it, Buckety. 250 new mates.
Buckety the Death Adder is about to meet his new housemates.
In these 3 rooms, we have 250 of the world's most toxic snakes. King browns, taipans, tiger snakes. And we milk them, we extract their venom. We send that off to be made into anti-venom and we save lives.
But before Buckety moves in, Tim must milk the lethal snake.
This is the dangerous part. You need absolute concentration, absolute focus. One slip up and you're bitten. Whoa, look at that, good boy. As soon as Buckety sees that vial, I think he thought it was my arm and it was just a grab. Look at that, that's enough in there to kill a couple of grown men. It takes at least dozens of milkings to make 1 vial of anti-venom. If you were bitten by a Death Adder, you might need 10 vials of anti-venom to recover. That's a hell of a bite. I'm glad that's not me. What happens from here is we actually freeze dry this venom and we send it off to the Commonwealth Serum Laboratories. They turn it into anti-venom. This is our job done. Off you come, mate. You got a bit of attitude.
Buckety will now be a permanent part of the park's venom production unit and will be milked once a fortnight.
Australia has 10 out of 10 of the most toxic land snakes on Earth. We have 2,000 bites every year, 300 of which receive anti-venom. Can you imagine how many people could die if this place didn't exist? Sleep tight, mate. You did a good job today.
Hi, I'm Dr. Danny Busek. If you love our show and want to see more amazing stories from the Bondi Vet team, just hit the subscribe button. Click that little notification bell and we'll see you for our next video.